Thank you, Mr. President. I rise to speak to the motion.
Senator has the floor.
Thank you, Mr. President. I, too, am going to vote for this budget. I think the Finance Committee did a stellar job. You had many tough decisions to make. But it does pain me to hit that green button because Medicaid expansion is not part of this budget. And in the governor's budget, he had allocated $3 billion in federal money coming through the budget to pay for Medicaid expansion. It would have saved $157 million in our budget. And all of us have gotten up at one time or another and asked for very worthwhile projects. We've identified needs, and yet once again, we are spending state dollars on many health care needs where we could be spending federal dollars. We've all talked about Medicaid expansion, and we know that there are 400,000 individuals in the Commonwealth who are uninsured and would be eligible for this program. We know that more than 70% of these people are working. They are contributing to the economy. They are in jobs that are important to our communities. And yet, we're ignoring the fact that they can't afford to pay to go to a doctor. So they end up waiting until they are extraordinarily sick. Their condition is quite serious. They take time off from work. They go to the emergency room. They don't get good treatment. Their condition is so far advanced, they don't get good outcomes. And you and I are paying for it. Our insurance premiums go up. We have to do something about this. 31 states are participating in Medicaid expansion now, including Louisiana and Arkansas. Why are we racing to the bottom here? This is just mind-boggling. It is very, very, very painful. It's difficult to explain. It's difficult for some of us, it should be, to look our constituents in the eye and say, I can't help you. You have to wait 6 months until there's a RAM program that comes here to provide services, or there's a medical van that comes to give you health care. That's just not the way. That's not who we are as a Commonwealth. That's not what we should strive to be. So I ask going forward that let's stop. Let's stop spending $5 million a day in Virginia tax dollars that go to the federal government to support the expansion in 31 other states. Let's stop doing that. Let's acknowledge that we do have people in the Commonwealth who need insurance, that we can provide this insurance through Medicaid expansion, and let's get on a path to doing that. So thank you for your indulgence, and again, I do know that there's some very positive things in this budget. I applaud the fact that we're doing some good things in mental health services for children. I applaud the fact that Fostering Futures was retained in our Senate budget. So I do know that many of us in this chamber are going to try to solve some serious problems in the Commonwealth, and we do care about the quality of life of all Virginians. And I do appreciate whatever small efforts we can take together, again, to move the state forward. Thank you.